Good morning, delegates. So it's a wonderful day at Vizag. It's really one of the wonderful conferences we have. This is our program, today's program. I thank AIOS giving us a full session of 75 minutes in the All India conference, both in the main conference and the midterm conference. And our session, it's a teleophthalmology. There's a lot of people that do not know till now what is the teleophthalmology. But of late, Teleophthalmology Society of India has done a lot of programs all over the country. As you know, teleophthalmology is a branch of telemedicine that delivers eye care through digital medical equipment and telecommunication technology. Today, applications of teleophthalmology encompass access to eye specialists for patients in remote areas, ophthalmic disease screening, diagnosis and monitoring, as well as distant learning. Blindness is a major trauma which affects an individual not only physically but emotionally too. It is a global phenomena, and in spite of all our efforts of reducing the blindness, is increasing. And 82% of people, blind people, are above 50 years. They live in the rural areas, unreached areas. Basically, lots of these people who live in the rural villages, in the hilly areas, are suffering from preventable eye disease, and some are blind within them and do not get proper treatment and screening of their eyes because of non-availability of ophthalmologists and infrastructures. And as you know, India is one of the country where there are shortage of doctors, shortage of ophthalmologists. We are about only 20,000 ophthalmologists with a huge population of 140 crores. So there is a disproportionate doctor-patient relation or doctor-population relation. So, and majority of this 20,000 ophthalmologists, they are concentrating in the urban areas only. They do not want to go to the villages. So how to take these people to the villages? So again, infrastructures in the rural areas are very, very poor. Lot of our regions are ill-traveled. They no accommodation, no transport, everything. The doctors find a lot of difficulties in going there and staying for months together to treat the people. So the lack of transport, lack of financial status of the patients make it even more difficult to provide healthcare in the rural areas. So here comes the role of teleophthalmology. It is a branch of telemedicine or telehealth that has evolved into an integral clinical tool in the Indian healthcare system. Of late, during the COVID time, you must have seen how teleophthalmology came into the rescue for the patients who have been operated quite before. For the screening purpose, for the follow-up purpose, teleophthalmology is one of the branch which has came into the prominence. It allowed clinicians to provide quality healthcare outside their clinics through the digital technology, thus improving access to medical care, better patient outcomes, and overall patient satisfaction, because patients did not have to travel a long distance to show either for the post-operative follow-up to the doctors. It's a very effective model for improving eye care delivery system in the rural and underserved areas of our country. It is a rapidly developing field. It has the potential to improve ophthalmic care and diagnose many eye diseases in early stage. That is very important, diabetic retinopathy, glaucoma, even refractive errors also. If you detect them early, probably you can prevent this blindness. Ultimately, the goal of teleophthalmology is to decrease the global burden of vision-threatening disease, and improve the quality of life of patients with eye disease worldwide. It will provide high quality, cost-effective community eye care at the doorsteps of the community. Thus, it can be a very effective model for the improving eye care delivery system in India. The objectives of teleophthalmology is to make eye care service accessible and affordable by reducing travel costs and time for the patients, to enable people at remote areas to have access to the specialist eye clinic or eye care facilities which are available in the urban areas only. So, taking into account, we have seen that a lot of teleophthalmology services have been carried out by various centers like Shankar Nethralaya, Arvind Eye Hospital, then LVS Eye Hospital, but they are all scattered during the different places. So, our aim is to integrate all these systems into one system so that everybody can do the same thing and it can reach the common ophthalmologist. So, thus, Teleophthalmology Society of India was formed in April 2021 to bring all people who are doing teleophthalmology into one system and under one banner. So TOSI was born on that day with Professor Natarajan, Padma Shri Professor Natarajan being the president, and Dr. Kim, the president-elect, and Dr. Rajiv Ramman were the leading pioneers in teleophthalmology. They are the office bearers of the society. So, dream of Teleophthalmology Society, dream of eye care should reach every village in India. So there are about 764, 369 villages in India. So eye care should reach each one of them. And to eliminate diabetic-related blindness from India by 2025 and eventually the world, that is our vision of our President, Dr. Natarajan, we must screen all diabetes in our country. The diabetes has increased phenomenally in the last 5 years, I would say. It was 80 million sometime back, now it's crossed 100 million in our country. So outline the components with the use of smartphone to take good retinal photographs, portable, sustainable and cost-effective equipment of screening for screening a large population, training unskilled workers to make them semi-skilled, and generating employment among the uneducated youth of India, preventing them from being burdened to the society. Generating enough manpower to screen diabetics in 764 villages of India. So these are some of the eye care devices available. They are portable, also economically viable for people to carry them to the rural areas to do the screening of many ideas, like even cataract also can be screened of these devices, glaucoma, diabetic retinopathy, ARMD, refractive errors also. So teleophthalmology advantages: extensive outreach, avoiding unnecessary referrals, health education, timely intervention in emergency situation, saves cost and time of for the patient, and it's a professional opinion can be delivered to the people, even practitioners too. Protection against the infection which we have seen during the COVID infection. New additions to teleophthalmology are the teleophthalmology with artificial intelligence. Some of the speakers will speak about artificial intelligence. 5G is giving the fastest transmission of the data from one center to another center, and of course another 5 years we are getting 6G also, still faster. A metaverse, establishing virtual clinics in the rural areas, that will also help the poor community patients. So teleophthalmology in future, what we aim that teleophthalmology ATM is a one-stop digital touch point integrated machine designated to diagnose the disease and deliver primary care. These are planning in the future. They already come up. Some China-based companies already come with the ATMs which can be installed in various public places like stations, airports, where a person can enter into this and just check his eye whether it is referable or not referable. That's very most important, particularly diabetes and glaucoma cases.
Teleophthalmology is a form of virtual eye care consultation that can be conducted remotely. MedicMind provides patients with equitable and affordable eye care. Designed in New Zealand for the world, we bring you the Teleophthalmology portal. It is a cost-effective method to reach out to your clients. This is extremely useful for consultation from remote locations, which could save clients from traveling to a tertiary hospital. MedicMind service is simple, secure, and free. It is easy to set up without any downloads. The portal's video conferencing tool is encrypted with the highest level of security, technical, and industry compliance. Confidently schedule and launch meetings from your web browser, whether it is from your mobile phone, iPad, laptop, or desktop computer. It is as simple as clicking a link. With Teleslit Lamp and Teleretina, provided by ODocs Eye Care, live retinal examination can be performed with a virtual meeting via video or mobile adapters. Consulting specialists can now view the patient's eye remotely. Empower your clinical care now. Saving sight made easy.
So thus, Teleophthalmology Society of India is formed. The form is available with us. Please do contact, be a member of society and share your experience with us, which can be transferred to some of the members all over the country. And recently we had a discussion with our SAARC countries, SAARC counterparts like Sri Lanka, Bangladesh, Nepal, to start their society and to coordinate with each other, forming a SAARC Teleophthalmology Society. SATOS is under cards. We are in the process of developing this society. So I request our president to take also interest in the formation of this SAARC Teleophthalmology Society. I have already discussed with them. So let us all invite SAARC countries representatives once and propose the formation of society for the integrating teleophthalmology service of all the SAARC countries. The aim is to coordinate teleophthalmology services of all SAARC countries for the benefit of the common man in the subcontinent. So this is the session today. We have got speakers. Will be anything you do, you have to follow some guidelines. I have with me Dr. Manoj Chandra Mathur. Everybody is well-known figure in India. He is the treasurer of our country, AIOS. He is our dynamic treasurer of IAOS. He is a brilliant academic career and extracurricular record in college, and after PG, he underwent a long-term fellowship in glaucoma. He is a private practitioner based in Hyderabad, and he's got several scientific presentations, state and national levels. I will take another 2 minutes. So, he will be speaking on the guidelines of teleophthalmology. Of course, our Teleophthalmology Society is surrounding this person, great person, who is a Padma Shri awardee, Professor Natarajan, our dynamic past president of IAOS, and now also is very much active in the society, not only in India, all over the country. He is the brand ambassador of teleophthalmology in abroad. So everybody knows him very well. He is honored by the government of India with the Padma Shri. He has dedicated his life toward the rendering human service to the mankind by treating the vision impaired. After achieving the clinical success in ophthalmology, now he is dedicating his whole life for the community, basically mostly for the diabetes and diabetic retinopathy. So not just a surgeon, is looked up as a healer by those shattered by the vision loss. Mostly you must have seen in the Kashmir with the bullet injuries, how much he has served our country and the people there. He is the founder, chairman and managing director of the well-reputed Aditya Jyot Eye Hospital at Mumbai. Dr. Satanshu Mathur is again a consultant and Chamunda Hospital and the High-Tech Eye Hospital in Kasipur, Uttaranchal. He is also chairman scientific and AIOCMTC2, treasurer of BS, all those societies is mostly associated. He will be speaking, he will be one of our speakers in this program. Dr. Arvind Moria, he is the additional professor and head of the Department of Ophthalmology, All India Institute of Medical Sciences, Hyderabad. He has been awarded Srimati R.K. Devi Memorial Equine International Award for the excellence. He is very much associated with the community of ophthalmology. And of course, last but not the young, dynamic Prasanna Venkatesh is the research director and glaucoma head at Mahatma Eye Hospital at Trichy. He has got delivered a lot of scientific topics in teleophthalmology and also metaverse in ophthalmology. He is the chief instructor and faculty in various national and international conferences. He will be our last speaker in this today's program. So thank you very much for joining with us for the teleophthalmology session. Now I request our treasurer AIOS and the member of AIOS, Tausi, to speak on the guidelines about the teleophthalmology. So whatever you do, you have to follow certain rules. You must have to limit it because otherwise you will be in the trouble. So I request Dr. Mathur to come back and speak about the guidelines of teleophthalmology. Thank you. Thank you, everybody.
And Dr. Subudhi, thank you very much for a wonderful talk.